Actually, we're presenting one of our papers. This paper about comparing two skin incision for microscopic lumbar discectomy, the classic one, which is the paramedian vertical incision, and now we compare to the transverse one. We're actually comparing regarding 3 points: provided surgical cutaneous outlet, which mean the approach and the corridor for you, the post-operative pain from the two incision, and finally the cosmetic outcome for both of them. This is a prospect random study design, which was over 46 months period, including follow-up period. Inclusion criteria was persistent sciatica for more than 6 months despite maximum conservative treatment, which the patient failed conservative treatment, and the MRI showing lumbar disc compressing the correlative nerve root at L4-5 and L5-S1 levels. We excluded, to make a fair judgment, previous spine surgery because of the adhesions, any patient with history of poor wound healing and keloid formation, because this will affect the ultimate cosmetic outcome, and other spine pathologies which may mimic sciatica, like facet arthropathy and sacroiliitis. And body mass index more than 35 kilogram was excluded because it affect the microscopic approach. We recruited 86 patients who was enrolled, and they were divided in 2 groups: the vertical incision group, V group, and the transverse incision group, the T group. The maximum surgical cutaneous inlet was measured in 2 diameters, rostrocaudal and lateromedial. The post-operative pain was recorded using numeric patient rating scale, like the visual analog scale, which from 0 to 10 was 0 indicating no pain. This was measured at the 1st, 3rd, and 7th day post-operatively. And regarding cosmetic appearance, we depended on the patient and plastic surgeon evaluation using a camera, digital cameras, 30 centimeters away from the wound, and the rating was either they will choose excellent or very good or fair or poor. This is actually our technique. The one on the left side is the classic technique. Sorry. On the left side is the classic technique where you do a vertical incision, 5 mm paramedian, centered on the thoracic intervertebral disc level. And then on the right side, the one we are using now, the one is a horizontal skin incision, which has been centered again on the thoracic intervertebral disc level, just 5 centimeter on the contralateral side to start, then 5 millimeter, then another 20 centimeter, 20 millimeter laterally. Our result that regarding the surgical cutaneous inlet, regarding the corridor for surgery, more or less both approaches give the same width. Regarding the pain score, for the 1st and 3rd post-operative days, we found that the vertical skin incision had less pain, but the 7th day both were the same, and we'll discuss later why. And there, regarding the cosmetic wound, the transverse incision has much more superior outcome, both in the patient and in the plastic surgeon evaluation. For discussion for the surgical inlet, we said that positioning of the skin incision was the utmost factor, just targeting and centralized on the area of the thoracic intervertebral disc making level. We have several modifications over the last years over this incision till we reached where exactly to put the horizontal incision. Regarding post-operative pain, regarding anatomical study, the L4, L5, and S1 has not a dorsal rami which is supplying the skin on this level. This is despite that the upper lumbar and lower thoracic has a plexus which supplies, as you've seen, the area dotted in yellow, which means the area with dotted blue is deficient from a rich dorsal innervation. That's why when you do a transverse skin incision, somehow you encourage on the yellow dots. That's why it's a little bit painful. But the vertical, because it's solely on the blue dots, that's why the pain score in the 1st and 3rd post-operative days was higher in the transverse skin incision, but at 7 days both were equal. And definitely cosmosis, because transverse skin incision will follow the Langerhans skin lines of the skin, which definitely give a superior cosmetic outcome. So as seen here with the conclusion of our study, that transverse skin incision for microscopic lumbar discectomy is an applicable alternative to the classic vertical incision with better aesthetic results for the patient. The paper was accepted and for publishing in the World Neurosurgery of the WFNS. Thank you.